Today we are speaking on belladonna. I would go a step further saying that जो होम्योपैथ के पास belladonna नहीं है वो झूठ है. If a homeopath does not in his medical chest or in his clinic or in his dispensary, if it doesn't have belladonna, वो होम्योपैथी नहीं हो सकता. इसका ये मतलब है belladonna plays a major role in our life. Now, how do we differentiate belladonna and aconite? Now, the whole homeopathic faculty knows that aconite and belladonna, aconite and belladonna, aconite and belladonna, both both are sudden and violent. Both in these both remedies, the attack comes like a storm and goes like a storm. So here we have a lot of similarity between these two remedies. Then how do we differentiate? The main factor of differentiating is aconite is I to my. Now what do you mean by I to my? I am having fever. I am having body ache. Or I am having whatever, when I am having joint pains. I. It starts from I. That means it starts from generals and goes to the particulars. Now, what is the particular here? I had fever yesterday. Today, my throat is aching. I to my. I had body ache yesterday. Today, my head is aching. So here it goes from I to my. That is from generals to particulars. Now, here when we talk about belladonna, it is from my to I. Now, my to I is, you'll say, my throat was aching yesterday and today I am having fever. That is from particulars to generals. From locals to generals is belladonna, and from generals to locals is aconite. This is the two most important differentiating feature between aconite and belladonna. Now here, when we talk about belladonna, it will affect a local organ initially and then go into the general category. That means what? You'll have a headache and then it will be followed by fever. Or first you will have a throat inflammation and then it will be followed by fever. Or you'll have one single joint pain and then it will be followed by fever or body ache. Or I would go a step further saying that you'll have a toothache, one single toothache, and then it will be followed by fever or body ache. So here it starts from locals and goes to the generals is belladonna. So now this is the classic symptom of belladonna. Though both aconite and belladonna both are acute, both come like a storm, go like a storm, both have got violent symptoms, but still there is a great differentiating feature between these two. Now here, when we talk about belladonna, there are three, four things you have to have the emphasis on. First and the foremost is sudden and violent. Yes, which is also there in aconite. Second is burning heat. Now, what do you mean by burning heat? If a belladonna patient is having headache followed by fever, if you touch the forehead, you immediately remove the hand because there's a even the you will have that sensation of heat, burning heat into your hands. So that burning heat is very important feature of belladonna. Aconite also has got generalized inflammation, but does not have this typical burning heat of belladonna. Burning heat, redness, The face will look red. The eye will look red. The ear will look red. Whenever there's a toothache, the cheek will look red. If you see the throat inside with a torch, you'll find the tonsils are red, burning heat. So all these things has got a origin burning heat with redness. And of course, the later part is the delirium. Later part is the delirium. Now, what is this delirium in belladonna? They say the belladonna delirium is violent delirium. Now, what is violent delirium? Where they can be, it can cause, the patient can cause violence. Now, violence, I'll tell you, my dear friends, what type of violence? Not necessarily that he has to keep on beating everyone, or he has to, not necessarily he has to go with a sword and cut everyone. No, violent reaction is he will bite, he will strike, he will spit, or he may hit. Bite, strike, spit, and hit. These are all a part and parcel of belladonna. So there you have belladonna, which is very violent. His reaction is violent. He's a small child. He knows he cannot fight against the big man, but he can spit on that big man. Spitting, tumku shakto. So here, this is a violent delirium of belladonna. It is a violent reaction. He may spit. He may bite also. He may bite. So here, belladonna, when is it worse? So remember, my dear friends, belladonna is worse by slightest motion, jar, touch, pressure, light. Now, light, what will, if it's a toothache and there's a bright light, that means the toothache is going to be worse? No. We are talking about the eye complaints here now. If there's inflammation of the eyes, the first stage of conjunctivitis, the first stage of conjunctivitis, that is dole ene, dole ale, the first stage of conjunctivitis, the eye gets inflamed. When the eye gets inflamed, the redness, and worse by any bright light. Noise. Now, what is it? What difference going to make for a person with a conjunctivitis if there is a loud noise? No. Here it is the ear which is involved. The ear is involved. Whenever the ear is media, otitis media is there, the redness of the ears and burning heat. If you touch the ear, there's a burning heat. There, it will be worse by noise. Any loud noise, and he will be irritated. You say, no, please don't make that noise. My ear is paining. Of course, jar, motion, touch is there. Along with that, the pain in the ear is also worse. So anything with all these symptoms, with all these modalities, we think of belladonna. Here, he has got, as I told you, he's got a violent delirium, and he, during the violent delirium, or during, for example, whenever there is a severe headache, the severe headache is worse. Now, remember, listen to my words. The severe headache of belladonna is worse by lying down. Worse by lying down. Why is it worse by lying down? There is a rush of blood to the head. There is a throbbing of carotids. The carotid vessels, there is a throbbing of carotids. The rush of blood to the head. There is a great congestion in the head. So, moment he lies down, the body is in line of the heart. Heart and the body is in one line. So, the rush of blood will be more when you lie down. But belladonna is better by sitting straight. Perpendicular position is better in belladonna. Whenever he says, he sits straight, exam erect. He sits erect and he feels better in a perpendicular position. Worse by lying down, better in a perpendicular position. When he lies down, is worse. But again, when he sits in a perpendicular position, he cannot move. Slightest motion, jar बोले तो धक्का, touch, pressure, all is worse. He cannot be bear to do anything of this. And the attack is always violent and intense, sudden and violent and intense. That's why, excuse me, that's why you'll find Belladonna, he wants to be quiet. He doesn't want to speak. He wants a dark room. He wants to sit in one place. He cannot lie down. So all these things are connected with Belladonna. Now you'll ask me, sir, why do you say that जो होम्योपैथ के पास बेलाडोना नहीं है वो झूठ है? Because we come across host of acute problems in our own practice. Let's start from the top. Now belladonna is worse by cold. Also, that's why whenever he has a haircut, he can get a headache. Now, why haircut? Hair is a great insulation between heat and cold. It is a great insulator between heat and cold. It is nothing but wool on the head. It is keeping the regulation of the brain temperature in the head. It regulates the temperature of the brain in the hair. In the temperature of the head. That's why hair is an important part of our anatomy. It keeps our head cool. Now, whenever he has a haircut, the head becomes more cold. And when it becomes more cold, belladonna is worse. Though there is a burning heat, in the head, inflammation, redness, burning heat, the face is red, the eyes are red, whichever part is affected is red with burning heat, followed by fever or body ache. Now, when we talk about a headache, as I told you, worse by lying down, better by sitting up. So, sudden and violent headache, where the child can go into convulsions and violent convulsions, where he may strike someone. You try to pacify the child and he may strike the child. The child may strike the person who is trying to pacify him. You try to hold the child will strike back. So here you have this is a typical reaction of belladonna, where the belladonna patient will strike back. He strikes back. That's again a very important complaint because he's got a violent delirium. So here during convulsions also, it is a violent convulsions. Here because of the fever, like the meninges are affected here, and then he can go into severe convulsions. Then slightly down, if you see the eyes, as I told you, the first stage of conjunctivitis, आंखों देखा हाल, first stage of डोळे येणे, डोळे हे जुलमीकडे, डोळे येणे पहिला stage is belladonna with redness, heat, burning. You can see the redness, heat, and burning in the eyes, inflammation. Cannot tolerate light. Worse, photophobia, cannot tolerate light. Then further down, the nose. The nose can become red. Sudden pain in the nose. There is always heat, burning heat, which is present. Cannot tolerate cold air. Inhaling cold air. If he tries to inhale cold air, there will be pain in the nose. But again, all these are sudden and violent. The ear cannot tolerate noise, cannot tolerate jar, motion. If you try to touch the ear, you won't allow you to touch it. And the ear is hot to touch. Burning heat. The moment you touch, you take out your hand. You say, no, my God, it is too hot. You can feel the sensation of the heat in the fingers for few minutes after you touch the patient. Then here we come down to the mouth. Sometimes for no good reason, for no particular reason, there can be a toothache. Probably some food particle is stuck there and there can be a toothache. Though the tooth, no, if the tooth is caries, the remedies are different. But here there is no caries. Here there are no caries. दांत किडलेले नहीं है. There are no caries, but still there can be pain in the tooth, and the pain in the tooth can give rise to sudden pain in the tooth. Cannot even tolerate to touch the tongue. Forget about forget about eating food, because when you eat food, you're going to masticate, and then you're going to chew on the food. Whereas you cannot chew because you cannot touch the teeth. Slight words by slight motion touch. So here the toothache is there's a redness of the tongue of the cheek also, and here because of the redness he feels better by warmth and not touching it, but it is sudden and violent, and a toothache can be so severe it doesn't allow you to eat, doesn't allow you to drink, and doesn't allow you to sleep because you can't do anything. If there's a headache, at least you can press the headache. You can tap something. You'll ask someone to give you a massage. But what about the toothache? The toothache is such a thing where toothache and earache, you can't you can't just pacify it. You can't hold the ear and ask someone to reduce the pain. No, you can't do it. So toothache, sudden toothache. The throat can be so severe, cannot even swallow his own saliva. He cannot even swallow his own saliva. स्वतःची थुंकी सुद्धा गिळू शकत नाही. It can be so severe, cannot even swallow his saliva. The swallowing mechanism is absolutely stopped, and then it can be followed by fever or a body ache. But it starts with throat, as I told you, from my to I is belladonna, from I to my is aconite. So my to I, here we have a severe throat inflammation where the tonsils are red, the throat is totally red with burning heat and cannot swallow. So here we have a lot of problems here. Then sudden inflammation of the breast in a woman, sudden inflammation of the breast in woman. What happens? The breast becomes it becomes full of heat, cannot even touch the breast. And then if you try to uh, feel the breast, it is very hot and it is on the verge of engorgement of the breast, or it can go into suppuration also. In the sorry, in the second stage, initially you can stop this process of suppuration by belladonna. Before the pus formation is there, you can stop it by giving belladonna, and the inflammation of the breast can be reduced immediately because belladonna, when it is indicated, is one of the finest remedies I come across, and it is the fastest remedy also. One of the fastest remedies and one of the finest remedies. Then, even in the inflammation of the lungs, sudden inflammation of the lungs become painful. The lungs become painful. We feel like as if the pneumonia is setting in. The lungs become painful. Here also we can think of belladonna if there is a sudden and violent uh, onset. But the lungs are affected first, and then it is followed by fever. First fever and then lung affection, like in COVID. No, it is not there. Here it is the lungs are affected, then fever. So because as I told you, my to I is belladonna, right? Then we have I have cured couple of cases of gallstone colic. Now you'll ask me how. Now whenever gallstone are present in the uh, gallbladder, the gallbladder, whenever it contracts, it tries to pass the stone. When it tries to pass the stone through the bile duct, the bile duct goes into spasm. And if it goes into spasm, the gallstone colic, and that can be very, very severe. Can be so severe that the person, the person, I mean, it is an agonizing pain. So here, belladonna, if you give belladonna in this case, because it is localized pain. Remember, it is localized pain. It is in the same region. So localized pain and sudden and violent. If you give belladonna, that spasm will reduce and the stone will pass. You won't even notice that it has passed through the stools. It has passed through the stools. You won't even notice it because they are in few millimeters, 4 millimeter, 5 millimeter, 10 millimeters. I have passed stones till 15 millimeters of gallstones with belladonna only. I have passed them. They just pass without any problem. Acute pancreatitis. Now, this is again a very lethal condition because pancreas is a sort of a conductor of the enzyme orchestra. Pancreas is a conductor of enzyme orchestra, and of course, diabetes. That's insulin. So, if there is an acute pancreatitis, which is a typical case in chronic alcoholics, acute pancreatitis sets in. And if the acute pancreatitis sets in, the pain can be very severe, but again, it is localized. And I have been treated, I have treated 6 to 7 cases of acute pancreatitis only with belladonna, and no other symptoms, no other remedy. Belladonna can just set the cure whenever it is indicated, localized, sudden and violent with a lot of burning heat, and it is localized again. I'm repeating it, localized inflammation. Acute appendicitis. Now, I must have cured number of cases of acute appendicitis. No, none of them have gone for a surgery after that. None of them have gone because they were all advised surgery, and I had cured number of cases of acute appendicitis, even acute diverticulitis. Acute. I am again repeating the word acute because acute is a very important word here. Acute and sudden and violent. So here with acute diverticulitis also, I've got great results with belladonna. So here we have everything acute. Then there are certain glands which can be affected, like sudden inflammation of the ovary, acute or inflammation of the ovary, and then there's a heat and burning in the ovary, and again localized, sudden and violent. You think of belladonna. Acute inflammation of the testis. If it is acute, why not think of belladonna? Because here the belladonna has got a direct action on the glands also, but they should be infection should be very acute and extremely acute infection, and this infection has to match the symptoms of belladonna because again it is localized, starts with my, goes to I, and belladonna has got a great remedy for acute, I mean, inflammation of the testes. Then even a particular joint, when you talk about a particular joint, for no reason a particular joint gets inflamed. There's a lot of heat on the joint and burning, and better by warmth or better by not moving, better by not moving, better by complete rest. So here it resembles bryonia, but bryonia has got couple of joints which are affected. Belladonna can be a single joint with redness and inflammation, and we think of belladonna whenever the an onset is acute, sudden, and violent. Yeah. So here, I think I covered most of the complaints of belladonna uh, in uh, in the acute stage. And as I told you, you have to have in a medical chest, you've got to have belladonna stored because here, without belladonna, you are a handicapped homeopath. Belladonna, because you are going to get a lot of acute cases, a lot of acute problems, and here immediately you can treat those patients, and once you treat acute problem, chronically he becomes your patient. So please see that don't leave acute cases to anyone else. You are the person who is going to you are the person who is going to cure him. See that you cure him. Once an acute problem is cured, we will be with you all the time. So I'm opening up the gallery, and if you have some questions, you're free to ask. Any questions? Any questions?
No, sir. Understood.
No, sir.
You understood everything? यानी कि
Yes, sir. It's clear.
there must be some
Sir, it's clear.
fault in my teaching. That's why you're understanding
No.
everything.
Sir, it's clear.
ये क्या है? सरदार जी शेरगिल और सत श्री अकाल जी.
Yes, sir.
सत श्री अकाल.
सत श्री अकाल जी सर.
पंजाबी बात कर लेती हो?
सर एकदम क्लिअर आहे सर, काहीच डाउट्स नाही आहेत. सर नाही सर, थोडी समजते पण करत नाही, अजून बोलत नाही.
किसी पंजाबी बात करती हो? Okay, I'm closing the lecture. No doubts?
No, sir. समजते, तुटक फुटक बोलताही येते.
हाँ, काय म्हटलं?
कर लेते थोडी थोडी.
हाँ?
Yes, thank you, sir. Thank you so much. No doubt, sir.
Bye.
Thank you, sir.
So thanks for starting
Thank
the
you,
lectures
sir.
once again. Thank you for starting the lectures once again.
Well, no.
Bye.
Thank you, sir.
I've started a lecture, but there's no response. There's no response at all. Unfortunately. Only 10 students.
Sir, please continue for us.
Yes.
Okay, thank you.
Thank you, sir.